Okay, so I am looking for what medications I need to administer. My patient is going to be Myla Bush. She's a female, date of birth 3/28/1945. She's allergic to indomethacin. I'm going to go to her orders. Looks like I have an order for penicillin G procaine. She's due for 600,000 units daily, and it is an intramuscular route. Go back to her MAR, make sure that it's in there as well. So, looks like she has not had this today, so she is due for it. I'm going to gather my supplies. Okay, I have penicillin G procaine. It is dispensed as 600,000 units per 1 milliliter, and it is intact. Expiration is 7/2029. This is an intramuscular injection, so I'm going to get my supplies for that. Because she's receiving a dose of 600,000 units, and this is dispensed as 600,000 units per 1 ml, the dose will be 1 ml. We use a 3 ml syringe and a 1-inch needle for injection. Band-aid. Then I'm going to do my first med check. So I have penicillin G procaine, dispensed as 600,000 units per 1 ml. The dose is 600,000 units, so she's going to receive 1 ml. It's a daily medication, and she's going to receive it intramuscular. The expiration, again, is 7/2029. I'm going to look in her chart and see what this was prescribed for. Looks like she does have a slight fever of 102 degrees Fahrenheit. She's allergic again to indomethacin. And let's look at her lab results. Looks like she has an elevated white blood cell count, and she is syphilis positive, which is what this penicillin will treat. Okay, I think I'm ready to go to the patient's room. Knock, knock.
Hello.
Hi, I'm Lainey. I'm going to be your student nurse today. I'm going to hand sanitize and give you a little privacy. Could you tell me your name and date of birth?
Myla Bush. And date of birth is May 29th, 1954.
Okay. Mrs. Bush, do you have any allergies?
I do. It's going to be indomethacin.
Okay. All right, thank you. I'm going to set your bed up just a little bit so I don't hurt my back. I'm here to give you your injection of penicillin G. How are you feeling today? Do you have any pain?
No pain.
Okay. So the penicillin G was prescribed because you were syphilis positive. This is antibiotic that can treat that. And it looks like you also had a little bit of elevated white blood cell count and a fever, so this should help with both those things. Did you say you don't have any pain today?
Not at the moment.
Okay. So I'm going to do my first med check in the MAR. I have penicillin G procaine, dispensed as 600,000 units per 1 ml. She is due for 600,000 units, so she's going to get an injection of 1 milliliter. It's a daily injection and it is intramuscular. She is due for this at 1:44 p.m. today. Okay, and then I'm going to start doing my second med check. Or scan these in real fast. Since I just did my second, okay, I'm going to start getting this ready and then I'll do my third med check. So first I'm going to clean the top of the vial. Prepare my needle. Draw up 1 milliliter of air. I'm going to check this dosage to make sure that this is correct. I have 1 milliliter.
That is correct.
Okay. I'm going to dispose of this needle. Alright, now I'm going to do some hand hygiene, put on gloves, and do my third med check. So I have penicillin G procaine. I have 1 milliliter, which is equal to 600,000 units. This is a daily intramuscular injection. She is due for it now at 1:46 p.m. and the patient is Myla Bush, date of birth 3/28/1945. Her allergies are indomethacin. All right, Mrs. Bush, I'm going to give you this in your deltoid muscle, in your arm closest to me, if that's okay with you.
Yes.
Okay, I'm going to clean the site. I'm going to find the chromium process, go down 2 to 3 fingers and make sure I'm above the axillary line. Then I'm going to let that dry. Okay, so some of the side effects of this penicillin are localized redness on your arm from the injection. Have you ever had penicillin before?
Yes.
Yes, and did you have any sort of reactions to it then?
Not that I recall.
Okay. So hypersensitivity is always a reaction that we will look for, but we will monitor you closely for that. Otherwise, it can help with your syphilis and your infection that you have going on right now. Okay. I'm going to pull the skin taut. Insert at a 90-degree angle and inject the medication slowly. And then I'm going to wait for 10 seconds. Okay, are you doing okay?
Yes.
Looks like it's bleeding just a little bit, so I'll put a Band-Aid on that. Alright. My hand sanitize. I'm just going to clean up a little bit and document. Do you have any other questions about the penicillin?
I do not.
Okay, and I'll come back in about an hour just to make sure that If you're not having any reactions, and check on you again then. I'm gonna put you back lower down. Here's your call light. Don't hesitate to call us. And I'll give you back your table. All right, thank you, Miss Bush. Have a great day.
Thank you.